Another day with your fertility specialist. I remain your host, Ruth Ogogo, and I'm always excited to be with you on our live sessions. Today it's Friday. Yeah, thank God it's Friday. I'm excited. It's weekend. I know you're also excited. On behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying tuned. We are most delighted to have you join us this afternoon. Today, we'll be talking about life experiences, people that have gone through fertility issues and they were able to achieve their dreams of parenting and going through parenthood. Just to encourage someone out there that has already given up, that feels all is lost. This is someone's true experience at Alps Hospitals, and we deem it fit to also share it with you, our dear viewers, so you are able to be encouraged or you're able to encourage someone out there. And today, to do this with me today, we have Dr. Deborah Olubiyi. Dr. Deborah Olubiyi, it's good to have you with us. For the
Thank
sake
you.
of someone watching for the first time, it might interest you to know that Dr. Deborah is a family physician. She's a fertility specialist and a very, very good IVF specialist. And need I forget, she's the coordinator of IVF. Put it this way, she's the IVF coordinator at Alps Hospitals. Wow, it's so good to have you with us, Dr.
Thank you
Deborah.
very much. It's always a pleasure to be here. Good afternoon, viewers.
So, dear viewers, as we get started, feel free to drop your thoughts, your comments, your questions. We'll definitely attend to them appropriately. Please sit back and enjoy the show. Share this link with someone right now. Call up someone so they are able to participate and get as much as they can get from those chats this afternoon. Once again, good afternoon to you, dear viewers. Okay, so Dr. Deborah, we're talking about one of your clients that had given some of what she had gone through in her fertility journey. So she deemed it fit to give us her testimony so we're
Okay.
able to encourage people
Other
out there.
people. Yeah.
Of course, we would not want to mention her name just for the sake of privacy and confidentiality. But we deemed it fit that it's good we let the populace know
Yeah.
because she also has words of encouragement for people out there.
Okay.
So
That's
she
great.
obviously knows that people are going to go through this.
Yeah.
Yeah. So she said her husband and I and her were married at 25. Wow, that's quite early.
Yeah.
I can
That's quite
imagine.
early. Yeah.
Yeah, at 25. They were excited to start up their family. Yeah, most young people,
Yeah.
once they get
Always.
married, they're always
Yeah. That's the
envisaging
next
to,
step. The next thing
yeah.
in the plan. Yeah.
I know sometimes when you have those young fathers, they're like, I can't believe I'm a
Father
father.
already.
Oh, yes. So she said they were excited to start their family, but very early on, they faced challenges. She started battling with miscarriages. She had multiple miscarriages. She said she had up to five
Oh my.
miscarriages.
5 miscarriages.
Wow. This
Yeah.
is really, she said, each one was devastating. Yeah, you don't even have to mention this. Like, I can
Yeah.
imagine what she
Emotional
has to go
trauma, the
through.
physical trauma. Yeah.
Miscarriages. Wow.
Yeah.
So, with your experience, what are some of the reasons for miscarriages? Because I mean, for her to have one, two, and up to five,
Five.
does it mean
Yes.
she didn't do nothing and she just kept on seeing miscarriages happening? What are possible causes of this miscarriage that women could encounter in the course of their fertility
Fertility journey.
journey?
Thank you very much. So there are a lot of reasons why people have recurrent, for someone that's had more than two, say she has had this someone that has had recurrent miscarriages. So
Miscarriages,
there are lots
yeah.
of reasons for recurrent miscarriages. So some of the reasons could be due to some congenital anomalies in the uterus. Some people are born with a uterus that has a septum. There's like a septum, a wall dividing the uterus into two,
Yeah.
and that kind of uterus might not support a pregnancy, so they are predisposed to having miscarriages.
Miscarriages,
Yes,
wow.
other congenital anomalies too could make a woman predisposed at risk of recurrent miscarriages, like accurate uterus. Also, some people have other issues in the uterus,
Okay.
like polyps in the lining, endometrial
Okay.
polyps that could also predispose to miscarriages. Even fibroids, submucous
Oh,
fibroids, yes,
wow.
that could also predispose to having miscarriages. And so some women also have what we call adhesions intrauterine adhesions. So all that environment in the lining will not allow a pregnancy to sit comfortably. So that woman is predisposed to miscarriages. Then you can have some endocrine issues, hormonal problems that could lead
Yeah.
to miscarriages. For example, the polycystic ovary syndrome we talked about, some other endocrine issues like disorders of the thyroid gland,
Yeah.
yeah, even diabetes. All those
Wow.
issues could lead to recurrent miscarriages. There are things we call luteal phase defect. Some women, their linings do not develop as they should because of some deficiencies in some hormones in them.
Wow.
Yeah, so that kind of ish problem with luteal phase defect could also predispose a woman
To
to recurrent
miscarry.
miscarriages. Even a lot of medical conditions like high blood pressure that is not well
Oh.
controlled.
Oh,
Yes,
wow.
yes, even issues, heart conditions. All
Wow.
that could predispose a woman to recurrent miscarriages, and also
Okay.
some autoimmune disorders like
Okay.
antiphospholipid antigens. Yes, antibodies, which is something we test for in women that are having recurrent miscarriages.
Miscarriages.
What this causes that it causes clots to develop in the placenta. So that placenta is not able to function properly to
Properly.
maintain the pregnancy and the baby. So a
Okay.
miscarriage happens. So I
Wow.
think those are some of the reasons why a couple could be predisposed to having recurrent miscarriages. And any couple that finds them situation, you've had one, you've had two, you're going to have a third one, you should come to the hospital so that you're properly
Okay.
evaluated. Even a woman with a what we call cervical incompetence, a weak or lax cervix.
Oh,
Yeah,
okay.
those ones are predisposed to having second trimester miscarriages. Second trimester is from about the fourth month, because the cervix not able to hold that pregnancy as the pregnancy is advancing. So they could also have a recurrent miscarriages. So that couple should come to be properly evaluated so that a reason could be found for why they are having recurrent miscarriages, and then it could be treated.
Okay. Okay. So this is so we've heard some of the causes of miscarriages, problem with the eggs, problem with the sperm, and many other factors that she has mentioned in the
Yeah,
uterus.
problems with egg. I didn't even say it. Thank you for problems with egg and sperm could lead to chromosomal abnormalities, and that's one of the most common cause of recurrent miscarriages.
Yeah.
It's nature's way of terminating pregnancies that are not compatible with life. So a lot of first trimester miscarriages are due to chromosomal abnormalities, just that we don't
Wow.
test for them. Yeah, so that would be problems with the eggs. They will arise from problems with the eggs or the sperms. Even some parents, some
Yeah.
yeah, parents that have congenital abnormalities themselves are
Yeah.
also predisposed to
To having
having recurrent
children.
miscarriages.
Wow.
Yes.
Wow. So you see, dear viewers, there's just a lot that could cause a miscarriage, and that's why if you're a victim of one and then the second time, but you shouldn't wait for a third time. It's
Yeah.
good that you're able to seek help from a good hospital, not just anyhow hospital. And in fact, the painful thing sometimes when they have miscarriage, the way they are managed,
Yes,
yeah,
could lead to
that's
more harm being
more
caused.
harm.
Yes, could lead. You hear people saying that okay, that their womb is being washed, or they are
Mm.
saying they should, or they do overzealous curettage.
Oh
Maybe
my
when an
goodness.
evacuation is being done,
Yeah.
the overzealous so those that still do
Oh my
curettage,
goodness.
or even with the suction, overzealous suctioning,
Oh my
of the
goodness.
lining, and then damage just
Then
happen to the
you
lining.
just destroyed the woman's fertility
Exactly, and then
prospects
adhesions and all that
and
will
all.
set in, compounding the problem.
So
Yeah.
yeah, so dear viewers, this is we saying that if you have even if you're a victim of a miscarriage, where you also go to matters so
Yes.
that you are also
Where
sure
you are
that your
managed.
fertility is
Yes.
preserved with the
Exactly.
prospect of having more
Then
children
in
if you want
future,
to, even if not
yes.
immediately,
Immediately,
but
yes.
just that so you don't have to work. Because some women say after first miscarriage, the next thing pregnancy is not happening, and it's
Yes.
possible it's maybe the way the last
Body
miscarriage
has to
and or
recover. Those
evacuation
pregnancy hormones
was
have to go down.
handled.
Yes,
So,
yes.
dear viewers, this is also a note for you all to take. Okay, so she was saying that each one was devastating. It was like a piece of her heart was being torn apart. And of course, I can remember, I can imagine because this is more like you losing every product that you could have been able to hold and carry as your baby. So it feels, of course, like a part of you just
Yeah.
died. So sorry about that. For those people that are actually going through or have been through
Yeah.
that, it's really a painful one. She said, thank God for her husband. He was her strength. He held her when she couldn't stand. He listened when she needed to talk, and he just loved her. She went through it, they went through it together as a team. Well, so she said, so this is also a wake-up call for men.
Yeah.
When women, as a couple, you're going through fertility issues,
Together.
it's not just the woman.
Man, yeah.
As a matter of fact, what if it's even the man that is
That
even the
the
reason for all that you're
exactly.
going through? And then you don't just throw blame games on the
Not the
woman.
time
And
for blame
I
game.
mean,
To
even
support each
for the
other.
same goes for the woman, even if you know
Yes.
it's your husband that is the cause, you don't just put all the blame on him. You both have to support yourselves so that you're able to pull through, because it's always easier and better when you have the
You're
support.
united and you
Yes,
face this problem.
exactly.
Yeah.
Than when you have to do it alone. It's really devastating. You
Yeah.
feel lonely, emotions are mixed feelings
Yeah.
and all. So please, this is a wake-up call for individual partners and couples, for the men, for the women as well. Well, so she's saying, there were times she felt like giving up. She felt like her body had failed her. Wow. So she felt like what's happening? Maybe she was feeling less of a woman.
Man,
I
yeah.
mean, are there no women carrying their pregnancies? Why is
Why
mine
is it my
different?
story
And
different?
all. I mean, I can
Yeah.
imagine. Really sad. But then she said there was always a tiny ember of hope, and her husband never let that ember die, even though sometimes there are down times that even when you have hope, because
Yeah,
of the
no,
way
definitely.
you
We're human beings.
feel,
We go through the
yeah,
emotions.
you
Some
just,
days
oh
you feel
goodness,
better about it. Some days
yeah,
you're really low. That's why
exactly.
you need a support partner. You need the support from anywhere to that those your
Yeah.
low moments.
And-
Let there be someone to lift you up at that time. Very important, and that's why they should be united in this. It's not time for placing blame. Oh, I'm the cause.
and
You are the
all,
cause. It is you. It
yeah.
is not you. This is the time to come together and be united to face, the problem.
So she said, okay, her husband was able to see through the ember, and even though the time was counting against them, he was still strong for them. And then one of these days, a friend of hers shared a link, just like I would want someone to share this link
This
once again. Yeah. So you see, a friend of ours actually shared Alps Hospital page to her on Facebook. For someone watching from Instagram, from YouTube, from Facebook, share this link with anyone.
yeah.
You just don't know who would see this, and you don't know how far this can go
Go
to
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 help
help
somebody.
someone.
Yeah.
This was just Today is just like the day that she had that link shared, and see where we are today. She's sharing her testimony with us. So a friend of hers shared the link of Alp's page on Facebook. And on that page, she read a story about, okay, she said she heard a story about a 58-year-old woman who had given birth at Alps hospitals through
Very
IVF.
popular story.
She said it was incredible. Like you can imagine, she's like, so a 58-year-old woman
Woman
can give birth. I mean, how much more her that was
that's
even younger
younger.
than that?
Yeah.
Yeah. Because so she said it was like it was like a light in the darkness. It sparks
Imagine.
up. Yeah, it gave the spark that she needed to keep hope alive.
Yeah.
And then she showed her husband that page, the story, and then they decided to ask questions, find out how to reach out to Alps and all of that. And they were able to. She said after our contact with Alps team, after a series of investigation and tests, we were presented with our treatment options and advised to try ovarian and endometrial rejuvenation after hysteroscopy. Wow. That's also because that's in the course of hysteroscopy. I guess they recommended all of that for
For
her
her,
in the course
yes.
of hysteroscopy. That's because something was
Fight
identified.
that was wrong.
Yeah,
Yes.
something was,
Yeah.
and before she got to Ab, she mentioned, she said they had tried IVF once and it failed, though
Okay.
not at Alps hospitals, but it failed. They were disappointed, of course. But coming to Alps hospital, they had this beam of light that revived them that, okay, even if the first IVF they had tried somewhere else failed, maybe now we're giving a different solution.
Solution. They were
We are
properly
trying something
investigated,
new.
evaluated.
Yes,
Yeah.
exactly. So
Yeah.
yeah, so that this brings me to ask. So at there times, what are some of the should I say what are some of the histories that you get from your clients that will want you to say, okay, you would be a candidate for hysteroscopy, or we
Okay.
think you need endometrial rejuvenation or ovarian rejuvenation?
Okay. So from this story, this one has had 5 miscarriages. So
Mm,
and I'm sure that she might have had evacuation done, whether manual vacuum aspiration done or something to remove the products of
God.
conception. So she's a candidate for hysteroscopy because
Okay.
the uterine lining has been tampered with, because
Mm.
recurrent evacuation could predispose you to infection if it's not properly done and managed. And
Mm.
then if it's not properly done, it could predispose you to having uterine adhesions.
Wow.
Yeah, so hysteroscopy will help us look at the lining properly and evaluate and make sure none of these things, no infection, no chronic endometritis
Yeah.
or intrauterine adhesions are present. And if they are, they can be treated. So that's what hysteroscopy will do. Hysteroscopy will also help you know that this lining is normal. Even a woman that you're not suspecting, someone failed, she even had a failed IVF. So
IVF,
even a failed
yes.
IVF is an indication for a hysteroscopy, because you want to be sure, especially if you're sure that the embryos were of good quality. You
Quality.
want to look and find out why didn't implantation happen.
Happen.
Yes, so apart from being diagnostic, helping you to diagnose a problem, it could also help you to know that, oh, everything is fine with the lining, so that you're looking somewhere else for the possible cause of the problem. So
Yeah.
that was a very good decision that was done for
For
this
her.
couple.
So
Yes.
would, because from since she didn't mention if it was eventually her eggs or donor eggs she used,
Okay.
but she mentioned from here that she was recommended to have ovarian rejuvenation as well as endometrial rejuvenation.
Yes.
So
Yeah.
are there people you would want to recommend this ovarian on and endometrial rejuvenation for?
Yeah, so I'm sure maybe from the hysteroscopy, they saw some things, maybe intrauterine adhesion, it devitalized them endometrium. That could have led to the
Endometrial
yes, rejuvenation
rejuvenation
being
for
prescribed for her. And then for the ovarian rejuvenation, maybe from the evaluations and tests, maybe she was having maybe premature ovarian failure, maybe her
okay.
AMH levels were low. She didn't explain all that part and all that.
Yes,
So
yeah.
that could be a reason why, though she seems young, because they married at 25. So
25,
I would
yeah.
assume at most she'll be in her early 30s. That might be why ovarian rejuvenation was also, prescribed for her to do.
Okay. Okay, so she said the doctor and nurses and the ALPS team as a whole were so supportive. She said they explained the procedure and she decided to go for it. She said when they had the first IVF, they didn't recommend hysteroscopy. That's back where she
Okay,
did.
did the
But
first
by the
one.
time she came to ALPS, they recommended hysteroscopy.
Hysteroscopy.
She said, so in fact, she said, we thought it was one of the ways that hospitals used to, like, more like a way of collecting money.
Money. Yeah,
Yeah.
that's what
So
a lot of
she
people
said,
think.
they
Yes.
try to exploit
Yes.
their
But
clients.
the
Well,
hysteroscopy does a lot of wonders and helps to clarify a lot of things, and also
yeah.
treat a lot of abnormalities in the uterine lining, the endometrium.
So,
Yes.
so she
So
said
it's very important
eventually,
procedure.
so
Yes.
she said eventually when they explained to her the need for
Okay.
all this, she was able
Yes.
to understand why she needed
Needed to
it.
have it done.
Yeah.
Yes.
And then she had a successful IVF and it was just like a miracle. She succeeded
Can
and she got
imagine
pregnant.
after
And,
a
and she
series
was
of
like, yes.
failures,
And she was like,
it
after
will be like a
waiting,
dream, something that
yeah.
you've been dreaming. You still feel you're
Yes, I
in
can imagine.
dreamland. I
So she
can
was like,
imagine.
after waiting for 10
Oh
years,
my! So they
it
had gotten
was,
to 10 years by this
yes, you
time.
can imagine all this period of wait. She was like, it was indeed a miracle. She said, yes, our prayers were answered. And then now she's even giving counsel already. She said,
Okay.
please, my advice to all and every couple seeking fertility help, don't give up. Please don't give up. Hope is powerful. Seek
Hope it's
support.
yeah.
Explore every option and believe in miracles. They happen, they truly do. She's now trying to talk about her husband, and she said again, her husband was everything. She said without him, she doesn't know where she would have been. He
That's
was
how it
her
should be.
rock, he
Yeah,
was
that's how it
her
should be.
partner, he was
Partners
everything.
supporting
She
each
said
other.
anyone going through this needs strong support system.
Yeah, it
And then she's
helps.
saying to the husbands and partners of women going through infertility, she said, please be there, listen, be patient, understand that it's a journey for both of you.
Yeah.
Don't underestimate the power of your love and support. She said, now she's thanking Alps Hospital. Thank you for the opportunity to share. She said, I hope my story can bring hope to
Yeah,
all that.
definitely
This
will.
is really,
It
this
definitely
is,
will.
yeah, this
Yeah.
is really heartwarming.
Yeah.
So, Dr. Debbie, maybe you have some other things to tell us more from
Yeah,
what
so
you've
that
deduced.
for ovarian rejuvenation, like this story,
Yes,
she's a
yes.
young woman, like I said. I didn't even know they had this journey had spanned 10 years. No,
Yeah.
never give up, never lose hope. Very important.
Yes,
Hope is the
yes.
only reason what keeps us alive is hope. If you don't hope for a better tomorrow, then what are you doing alive? So, like she said, I'm reiterating what she said,
Yeah.
keep hope alive. So
Right.
this their journey had spanned 10 years. So, like I said, she was in like her early
That
30s.
is,
Maybe
yes.
she had premature ovarian failure. Why ovarian rejuvenation was recommended. So for also women that are postmenopausal, there's some women that are postmenopausal or turning in the perimenopausal period.
Yeah.
Advanced age women, women about the age of 40, 41, 42, that
Yes.
still, at this age, ovarian quality has really diminished
Declined.
and declined, yes. But some of them, for religious beliefs and for other reasons, might want to still try to use their own eggs. That's not the best of cancer, but we always support our clients in whatever decision they make, as long as we've given them the adequate information they need to make an
Yeah.
informed choice and decision. So ovarian, just these are also women who are candidates for ovarian rejuvenation. Yes, so we could do ovarian rejuvenation. They might need to have more than a session, and that has helped some women to achieve this their dream. It's not a 100% procedure.
Yeah. Yeah.
The guarantees are not 100. It doesn't work for everybody, but it has worked for a lot of women. So those are what those categories of clients could also explore, having ovarian rejuvenation done. Yeah.
Wow. So dear viewers, you see that, well, for this woman, it's as much as now it's sounding like a story. I'm sure when she was going through this,
Yeah, it wasn't.
it was a lot.
It can't
She
be.
had to deal with a lot. And then I can imagine what she had to deal with. Yeah, well, this is her giving us I'm sure this is more like a summary of all she had to deal with, because now she wouldn't have the whole time to explain how
No,
she
she can't even
encountered
dig in
all and
depth. She
all of
can't
that.
explain
Yes,
in
but
depth.
people that go through this fertility journey, they go through a lot.
They do. Yeah.
They have to deal with pressure from relative, pressure from even the society,
And
because
even
sometimes,
pressure from themselves.
yeah,
Yeah, even pressure from themselves. A lot of women, couples also put themselves under pressure. We've seen cases where it's not even the family, talking or raising eyebrows. It's even the couple themselves.
wow,
There are some standards, or what will I say? They've given themselves, or some people they are comparing themselves with. They're like, my mates. But you already know
yeah,
everybody has their unique stories. Oh, my mate has this, so why don't I? So even pressure that they've given themselves. Yes, so much to
wow.
contend with. Yes.
So this is to let you know that regardless of what you have, what you're going through, regardless of the hurdles that you might meet
Yeah.
along your fertility journey, there's hope. It can still happen,
Yeah, it can.
regardless of how late or how much
Long or
delay
how long you've
that.
been on this journey, it can still happen. Yeah. Just make sure you go to the right place and see the right people.
So
Yeah.
yeah, so I was just also going to ask, because this woman encountered an IVF failure, and
Yes.
then she seemed like, it would take someone that's strong after a first failure to still want
Failure.
to go into this.
Failure is never
She still
easy.
doesn't have a guarantee
Yeah.
that,
It
how am I
can
sure that it would work
work.
again?
Yes, I've
So how do
tried.
you deal with clients that maybe have had failures? Because I know these failures are everywhere. But how do you deal with clients that have had failure? I'm sure they might be filled with a lot of negativities and
Definitely, they
all.
are. They are, and they,
So
they
how do you
tend
deal
to
with
they
them?
tend to judge everything you're doing. They easily make aspersions. Trying to criticize everything. We just give them the right knowledge. Knowledge is power. We let them know. We take them through the process as whatever we're doing. We're counseling them. We're explaining what we're doing. Like this client that talked about, why should she need a hysteroscopy done. But when it was explained to her, she understood why it was important. So that's what we do. A lot of explanations, a lot of giving information, you know. So, and with that, you're able to get them to understand the process and what's happening. We don't keep them in the dark. That's how we deal with their doubts and, that's how we deal with it.
Okay.
Yeah.
And then based on your experience, what are the likely reasons that you think IVF could fail?
So IVF could fail for a lot of reasons. Number one, IVF is not 100% guaranteed process. That's one thing about IVF. Even the best of centers anywhere in the world, success rate for IVF is still between 30 to 35%. Yes, but what helps us in our center, our hospital, is that we make sure we do a thorough evaluation, and we're not afraid to present the truth to our clients. We tell them these are your options, these are what we
Wow,
think.
that's
You still make your choice, whatever your choice. Sometimes we're not happy with their choices, but we
yeah.
still support them in the process. Yes. So a lot of issues. Basically, the issues for failure are things to do with the eggs, poor sperms, poor embryos, and then issues with the uterine lining, or even issues with the uterine environment, the uterus as
As
a
a
whole.
whole.
Yeah. So if we have poor quality oocytes, this would definitely generate embryos are of low grade or low quality. So those kind of embryos, the chances of a pregnancy resulting, it's low. Yes, and then when you have issues with the endometrium, what we talked about,
Yeah.
intrauterine adhesions, or you have an endometrium where you have polyps, you have masses, fibroids, that's not the right environment for an embryo to implant and develop into a pregnancy and then a baby. And then if a woman has multiple uterine fibroids, especially those that affect the lining, or even adenomyosis, those are all issues that could lead to IVF failure. Yes, those are all
Okay.
issues that could lead to IVF. So a lot of issues could lead to
Reasons.
IVF failure. Yes.
Well, I was when you were saying this, I was just wondering what could have actually possibly been the reason that this woman had to have five miscarriages. Could it have
Yeah,
been? Yeah,
she
I
didn't really give
really,
us a picture
yeah, she
into
didn't
that.
give us so much,
Yes.
but I'm
But I'm
sure
sure it's probably maybe due to low quality eggs, since she needed
eggs,
to have ovarian
ovarian rejuvenation.
rejuvenation.
Oh yeah,
Yes,
so that
yes.
that
So
makes
people think once I'm
sense.
young, not everyone that is
Hmm.
young has good
Good
quality eggs.
quality eggs.
Yes,
True.
yes.
Hmm.
So those are some
Wow,
of
that
the
makes a
issues.
lot of sense.
Yeah.
So wow. So you see, it's good when you're having issues. It's good that you actually get to the right place where you are giving the right counsel,
Counsel, very
and then you are
important. Yes.
properly evaluated. You are giving so much attention, like attention to every detail
Every,
counts,
yeah,
like everything counts.
yeah.
They don't ignore any information, and that's
Aspects.
what you stand to get when you come to ALPS hospitals,
Yes.
because they seem to be every detail you mentioned, like everything evaluated, everything assessed for you is not overlooked, or
Yeah.
it's not just swept under the carpet. They take note of everything and they act on everything noticed. Well, so I have Toyin is saying, how do I share my story? Oh yes, so
Oh,
if
that's nice.
that's so nice,
Always
Toyin.
happy
Yeah,
to
it's
hear
we'll be
stories.
yes, exactly. We'll be very, very glad to get your story, dear Toyin.
Okay, I think I know this story.
Oh wow, so Tony, you are excited to see your message. You could actually you could gather your all that you want to tell us. You could send it to the message, to the number being displayed on the screen. You could send a WhatsApp message to the number being displayed on screen. Just whichever way. You could also do a private message on Facebook, or if you're just, you could actually just give us a private message on any of our handles,
We'll now
and
reach
we'll
and get in
definitely
touch with you.
get in touch with you, get the necessary information, and we'll be able to share your story out there, to be able to encourage someone, to light up the hope in someone,
Yeah,
and make them know that it is still possible to achieve your parenting dreams.
dreams. Yeah,
It's still possible to carry your babies while you keep hopes alive and stay positive
yeah,
and hope for the best. It's been amazing having you, our dear viewers, today. I don't know if you have counsel, yeah, based on this lady's
yeah. So your words, I'll
experience.
just repeat your words.
Mm.
Keep hope alive. Remain positive. Don't let the negativity. Don't let the problem overwhelm you. Some women become
Yeah.
consumed by the problem. They can't even live their
Mm.
normal lives any longer. Please don't let it overwhelm you. Don't let it consume you. And then seek help in the right place. Yeah.
Dear viewers, thank you for joining. Ijoma Eze, I see you. Now, Samuel, please forgive me if I murder the name, but all I'm saying is, I see you. Toyi, thank you for joining. Dixie, thank you for joining. It's been amazing having you, our dear viewers. Kenneth, thank you for joining. As many of you that are watching, we really see you guys. I cannot mention all the names, time will fail us, but we are really excited to have your viewers join us today. And we also look forward to seeing you next week, Wednesday. It's been good to have you, dear viewers. Stay with us. Continue to like our post, continue to share, continue to being
for
with us
having
today. It
me.
was really nice to have you.
Same here.
And
Thank you for
for
having me.
storyteller, we are glad that you shared your experience. Thank you for not hoarding this or keeping this to yourself, for letting the world know. Because sometimes you have people get all this and then they still want to paint another picture outside.
Yeah.
They still want to hoard information and not allow people to see the lights that they've seen.
Same
So we are
here.
glad that you are able to share this with other people so they are able to see the light that they've seen and they are able to try just the way you try. For everyone going through some hard time with fertility, we hope that someday you are able to achieve parenting dreams as you wish. Have a lovely evening. Thank you.